Something really crucial that I want you guys who are suffering chronic pain to understand is that you may have been told, or you may think that you know what structure your pain is coming from. And sometimes that's a label diagnosis, not an actual pain generator diagnosis. What I mean by that is you've been given a diagnosis of degenerative disc disease or simply just osteoarthritis. Those are label diagnoses that are based off of criteria on imaging. So the imaging looks like this, and therefore you get that diagnosis, whether it's, again, degenerative disc disease, osteoarthritis. There are other things as well. So it may be a label diagnosis, or you might have been Googling or working with a provider or something, and you maybe have given a different diagnosis, something like sciatica. It's what I see most often in this context that I'm speaking on. If you are suffering in chronic pain and you have always been approaching your pain based on those structures that you've been told, again, whether it's a label diagnosis or an actual pain structure diagnosis, and if you are not getting somewhere in your treatments, maybe the diagnosis was incorrect. Maybe the thing that you've been directing your treatments towards is not correct. So while you might have pain that radiates down the leg, you might not have any issue with your sciatic nerve. Therefore, all the treatments directed at your sciatic nerve might not be doing much. You may have osteoarthritis on imaging, but your pain might not actually be coming from the cartilage and the subchondral bone within the joint. You might have neurogenic inflammation of these branches of the saphenous nerve or the anterior femoral cutaneous nerve, or your patellar tendon might have some pain. There might be some pain coming from that, or the medial collateral ligament or the coronary ligaments, a lot of different structures. You may have been given the diagnosis of degenerative disc disease, but that's not actually causing your pain. What's actually causing your pain is the medial cutaneous branches of the dorsal rami, which are small little tiny nerves that are not picked up on an MRI, X-ray, ultrasound, or even a CAT scan, and they can cause a lot of back pain. So as you are going through this journey of chronic pain, always step back to maybe reconsider, maybe what we've been approaching and treating is not correct. Maybe I should look for a second opinion, a third opinion, a 40th opinion if you're at that place, and really try to let the provider come up with a diagnosis, not telling them I have sciatica. Just tell them what your symptoms are. I got pain that goes down my leg, and maybe let them work that up so they're not always working inside that box of a previous diagnosis. All right, buddy.